insight. Associated with psychoanalytic and humanistic approaches, grasping the inner nature of things intuitively. Free association. Psychoanalytic, the patient reports any and all conscious thoughts and ideas, sometimes while under hypnosis. Hypnosis. A state that resembles sleep but that is induced by suggestion. Manifest content. The images and occurrence of dreams. Latent content. Truly meaningful content of dreams, symbolized or suggested by the manifest content. Transference. Psychoanalytic occurs when the patient shifts thoughts and feelings about certain people or events onto the therapist. Countertransference. Psychoanalytic, when the therapist transfers his or her own feelings onto the patient. Analysts typically undergo analysis to avoid this. Client-centered therapy. Humanistic, Rogers, involves the assumption that clients can only be understood in terms of their own reality. Carl Rogers. Humanistic, client-centered therapy and self-actualization. Genuineness. Humanistic, the way a therapist must be open, honest, and expressive of feelings with the client. Unconditional positive regard. Humanistic, Rogers, therapist provides this for the client. Accurate empathetic understanding. Humanistic, Rogers, describes the therapist's ability to view the world from the eyes of the client. Gestalt therapy. Humanistic, combines both physical and mental therapies. Client acts out psychological conflicts in order to make them aware of the interaction between mind and body. Fritz Perls developed Gestalt therapy. Behavioral therapy. Short-term process, treats symptoms because no underlying cause. Abnormal behavior, both problem and symptom. Use techniques to change behavior. Counterconditioning. Behavioral, a technique in which a response to a given stimulus is replaced by a different response. Aversion therapy. Behavioral, an aversive stimulus is repeatedly paired with the behavior a client wishes to stop. Systematic desensitization. Behavioral, involves replacing one response, such as anxiety, with another response, such as relaxation. Extinction procedures. Behavioral, designed to weaken maladaptive processes, flooding and implosion. Flooding. Behavioral, extinction procedure in which a client is exposed to the stimulus that causes the undesirable response. Implosion. Behavioral, extinction procedure in which the client imagines the disruptive stimuli, rather than actually confronting them. Behavioral contracting. Behavioral. The therapist and the client draw up a contract to which they both agree to abide. The therapist rewards the client for certain behaviors. Modeling. Behavioral, a therapeutic approach based on Binder's social learning theory. Clients watch someone act in a certain way and then receive a reward. Rational emotive behavior therapy. Cognitive (LS), based on the idea that when confronted with situation people recite statements to themselves that express maladaptive thoughts. Albert Ellis. Cognitive, formulated REBT. Cognitive therapy. Cognitive, Beck. The focus is on maladaptive schemas, which cause the client to experience cognitive distortions, which in turn lead them to feel worthless or incompetent. Aaron Beck. Cognitive, happened upon cognitive therapy, negative triad, arbitrary thinking, and dichotomous thinking. Negative triad. Cognitive, Beck, involves a negative view of self, of the world, and of the future. This view is learned through experiences and then becomes a cycle of response. Arbitrary thinking. Cognitive, Beck, when a person draws conclusions without evidence. Dichotomous thinking. Cognitive, Beck, involves all her non-conceptions of situations. Electroconvulsive therapy. Biological, a form of treatment in which fairly high voltages of electricity are passed across a patient's head, causes temporary amnesia and can result in seizures, has been successful, used sparingly. Prefrontal lobotomy. Biological, psychosurgery, parts of the frontal lobes are cut off from the rest of the brain, leaves patients in a catatonic, zombie-like state. Psychopharmacology. Biological, the treatment of psychological and behavioral maladaptations with drugs. Psychotropic drugs. Biological, antipsychotics, antidepressants, anxiolytics, and lithium salts. Antipsychotics. Psychotropic drugs, clozapine, thorazine, haldol, reduce the symptoms of schizophrenia by blocking the neural receptors for dopamine, can cause jerky movements, tremors, and muscle stiffness. Antidepressants. Psychotropic drugs, MAO inhibitors, tricyclics, and selective reuptake inhibitors. MAO inhibitors. Antidepressants, EUTRON, work by increasing the amount of serotonin and norepinephrine in the synaptic cleft, block MAO, which is responsible for the breakdown of many neurotransmitters. Effective but toxic, dietary modifications required. Tricyclics. Antidepressants, norepinephrine, amitriptyline, imipamine, increase the amount of serotonin, and selective reuptake inhibitors. Antidepressants, Prozac, work by increasing the amount of neurotransmitter at the synaptic cleft, blocking the reuptake mechanism of the cell that released the neurotransmitters, fewer side effects. Anxiolytics. Psychotropic, Xanax, depress the central nervous system and reduce anxiety, while increasing feelings of well-being and reducing insomnia. Benzodiazepines. Anxiolytics, Valium, cause muscle relaxation and a feeling of tranquility. Lithium carbonate. Psychotropic, effective in the treatment of bipolar disorder. The mechanism of action is not known. Group therapy. Clients meet together with a therapist as an interactive group. "12-step programs." A form of group therapy, not usually moderated by professional psychologists. AA, strong social support system of people who are experiencing or have experienced addictions or other types of maladaptive adjustments to life. Couples therapy approaches the couple dyad as a system that involves complex interactions. Family therapy allows family members to express their feelings to each other and the therapist simultaneously. Compare the psychotherapy and biological therapy approach to treating psychological disorders. Psychotherapy is a treatment system in which a client and therapist use words and acts to overcome the client's psychological difficulties. Biological therapy involves the use of physical and chemical procedures to help people overcome psychological difficulties. How can transcranial magnetic stimulation be used to treat depression? TMS involves having a clinician place an electromagnetic coil on or above the patient's head. The coil sends a current into the prefrontal cortex. At least some parts of the prefrontal cortex of depressed people are underactive. TMS appears to increase neuron activity in those regions. It helps to alleviate severe depression. Describe the shortcomings of the biological approach to treating mental disorders. Treatments are capable of producing significant undesirable effects, often ignore the fact that behavior occurs as a result of non-biological factors such as experience. How do antidepressant drugs restore brain activity to normal levels? The prefrontal cortex of depressed individuals shows reduced activity and a lower than normal level of blood flow. Some studies suggest that antidepressants ultimately raise activity in this brain region and restore blood flow to levels observed in non-depressed individuals. Similar findings have been reported for the amygdala. Discuss the similarities between Freudian psychoanalysis, short-term psychodynamic therapy, and relational psychoanalytic therapy. All three types of treatment share the goals of helping clients to uncover past traumatic events and the inner conflicts that have resulted from them. All are focused on trying to resolve or settle those conflicts in order to resume interrupted personal development. Psychodynamic therapists of different theoretical persuasions might focus on different conflicts, but they tend to use similar techniques. Describe the technique of working through. Psychodynamic therapists and their patients re-examine the same issues repeatedly during treatment, with greater clarity over time to gain lasting behavioral change. Describe aversion therapy and provide an example. Instance: when a therapist helps a client acquire anxiety responses to stimuli, alcohol or drugs that have been too attractive in the past. Describe the criticisms of the behavioral approach to therapy. The behavioral approach is too simplistic to account for the complexity of behavior. Lab results may not generalize to real life. Describe the rational emotive therapy technique. Therapists using this approach first help clients identify the irrational assumptions that seem to govern their behavioral and emotional responses. Next, they help clients change those assumptions into constructive ways of viewing themselves and the world. One of the techniques the therapists may use is cognitive restructuring, in which clients learn to replace negative interpretations with more positive notions. How can specific upsetting thoughts contribute to abnormal functioning? Cognitions or automatic thoughts that are negative can be upsetting as we confront the life circumstances around us. Beck's cognitive triad of depression is an example of the negative consequences of such upsetting thoughts. Which of the following theorists would be interested in giving clients homework assignments, requiring them to observe and challenge their assumptions? Beck. Describe the characteristics of Gestalt therapy. Guides clients to self-recognition and self-acceptance, achieved by challenging and frustrating clients using techniques such as role-playing. Describe existential therapy. How is the concept of freedom addressed? Existentialists believe that we are born with complete freedom of choice in either giving meaning to our lives or shrinking from that responsibility. Existential therapists urge clients to take responsibility for their own lives and choose paths that allow them to live with greater meaning and stronger values. Compare and contrast the humanistic and existential approach to therapy. Gestalt therapists, like client-centered therapists, move clients towards self-recognition and self-acceptance, but unlike client-centered therapists, Gestalt therapists often try to do this by challenging and frustrating the clients. Describe the curative features of successful forms of group therapy. Provide guidance and models of appropriate behavior. Members should be allowed to take risks and accept criticism, as well as discover that other people have similar problems. Members can acquire and improve social skills and develop feelings of self-worth by helping others. What are the 3 types of prevention related to community mental health treatment? Describe how they differ. Primary prevention consists of efforts to improve community attitudes, whereas secondary prevention consists of identifying and treating psychological disorders in the early stages. Tertiary prevention aims to provide effective treatment as needed so that moderate or severe disorders do not become long-term problems. Discuss the behaviors and characteristics of successful therapists. Successful therapists tend to do similar things. They provide feedback to clients. They help clients focus on their own thoughts and behavior. They pay careful attention to the way they and their clients interact. They try to build a sense of self-mastery in their clients. How do internet sites that promote eating disorders work against therapy? Internet sites that promote eating disorders provide social support for maladaptive behavior. What percentage of individuals treated with electroconvulsive therapy experience symptom relief? Approximately 70% of patients experience symptom relief. Name 2 side effects of patients who underwent lobotomies. Death, seizures, stupor. What psychological phenomenon is exhibited when patients act and feel toward the therapist as they do toward important figures in their lives, past and present? Transference. What experience of reliving past, repressed feelings is believed to be a method of gaining insight? Catharsis. List the 3 categories of behavioral techniques. Classical conditioning, operant conditioning, and modeling. What is the list of feared objects or situations that are used in systematic desensitization called? Fear hierarchy. What concept describes the situation in which a desirable behavior is rewarded with the presentation of an object that can later be exchanged for food or other rewards? Token economy. In what settings do token economies typically occur? schools, prisons, or other places where a behavior can be monitored throughout the day. What are the greatest strengths of the behavioral model of treatment? Behavior can be observed and tested in a laboratory setting. Moreover, behavioral approaches have been effective for numerous problems, including specific fears, social deficits, and mental retardation. Describe the impact of Ellis's basic irrational assumptions. Thoughts reduce people's chances for happiness and success. What three qualities must be displayed by a therapist in client-centered therapy? Unconditional positive regard, accurate empathy, and genuineness. List 2 techniques that are commonly used by Gestalt therapists. Skillful frustration, role-playing, exercises, games, etc. Intense emotional expression may result when individuals engage in which Gestalt technique? Role-playing. What type of group therapy meets without the direct leadership of a professional clinician? Self-help groups. Describe the 4 questions that are addressed in therapy outcome studies. Is therapy in general effective? How effective for particular therapies, or particular therapies especially effective for certain problems? Is therapy equally effective across race and